All right, team, we have a patient presenting with necrotizing fasciitis, adenoiditis, and golfer's vasculitis. What are your thoughts on the diagnosis?
Necrotizing fasciitis is a severe infection of the skin. Adenoiditis is an inflammation of the adenoids, and golfer's vasculitis affects the blood vessels. It's a tough one.
Based on those symptoms, I think it could be a skin disorder, maybe something like epidermolytic hyperkeratosis.
I disagree, Kelly. Those symptoms are more indicative of a vascular issue. It might be a form of vasculitis.
Enough. The correct diagnosis is indeed epidermolytic hyperkeratosis. The patient needs liposuction immediately.
Liposuction? Are you sure, Hawks? It's a risky procedure.
Damn it, Gary. I know what I'm doing. The patient's life is at stake, and liposuction is the only way to save them. Now, get to work, all of you. Tracy, you called me here?
Yes, Hawks. I heard you want to perform liposuction on a patient you believe has epidermolytic hyperkeratosis.
That's correct. I've dealt with similar cases before. I know what I'm doing.
You can't just jump into surgery without consulting the rest of the team? Have you considered other options?
I don't need to consult anyone, Tracy. I have years of experience in this field.
I understand that, Hawks, but we always work as a team here for the best outcomes for our patients.
I am the expert here, Tracy. I know what's best for my patient.
I'm not questioning your expertise, Hawks. I just want us to work together on this.
I don't need your approval, Tracy. My decision stands.
Oh no, this is far worse than I anticipated. The patient is in critical condition. How am I going to break this news to Hawks? The liposuction was definitely not the correct treatment for epidermolytic hyperkeratosis. I should have gone with a different approach.
You three are a complete disgrace. You nearly killed our patient with your incompetence.
But Dr. Hawks, we followed the standard procedure for liposuctionary.
Maybe the diagnosis was wrong, not the procedure.
No, I think we misjudged the patient's condition. It was a mistake on our part.
You think. You're all a bunch of idiots. I knew I shouldn't have trusted a bunch of amateurs like you. Storms out of the room. I can't believe I haven't figured out what's wrong with the patient yet.
Maybe you should try considering a rare condition, or perhaps a misdiagnosis.
Oh, thanks for the suggestions, Dr. No, and all.
Hey, I'm just trying to help. Don't get all defensive.
Wait a minute.
I think I know what the issue is. I need to go check on something. See you later, Johnson.
Wait, what? You're just leaving in the middle of lunch without even saying goodbye. Typical Hawks.
Sorry for the interruption, but I have something urgent to discuss.
Hawks, what are you doing here without the proper gear? This is an operating room.
Yeah, you can't just storm in here like this. You're putting the patient at risk.
Hawks, we can't work like this. This is a serious violation of protocol.
I know, but I believe we've been looking at this all wrong.
It's not epidermolytic hyperkeratosis, it's pseudohypoparathyroidism.
Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks. But let's not forget that the wrong diagnosis almost cost the patient their life.
If you had just listened to me from the start, we could have avoided all of this.
I listened to you, Hawks, but I also had my concerns.
Concerns that nearly killed the patient.
And your arrogance didn't help either.
Arrogance. You were the one who refused to consider my opinion.
We are a team, Hawks. Let's not forget that.